Welcome back to The Broken Shift. My name is Natalie. Hit that like button, subscribe, and hit that notification bell if you haven't already so you could be notified anytime I upload a new video. And we're going to get right into it. I was scrolling through the wonderful world of Reddit, and then there you have it. I came across nurses were talking about the CDC not being functional after the Trump administration orders mass firing. So I was like, oh, I have to look into this because we knew that he said that he was going to let go of federal workers. It says the layoffs targeted leaders in departments related to respiratory disease, chronic disease, injury prevention, and global health. The New York Times reported roughly 70 epidemic intelligence service officers, also known as disease detectives, the entire staff and editors of the CDC publication, Morbidity and Mortality Weekly Report, and the agency's Washington office were all notified of their termination, according to the report. So I was like, wait a minute, let's go find this article. So I pulled up an article on this and we're going to talk about it. It was on time.com, and here it is. CDC not functional after Trump administration orders mass firings. And so let's read it together. I haven't read it yet because I was just like, what is going on? So let's find out together. Hundreds of employees were fired from the Center for Disease Control and Prevention, CDC, late Friday. So this happened this past Friday, as the Trump administration made good on its promise to begin mass layoffs in response to prolonged government shutdowns. Some 1,300 employees received notices that they would be let go, among them leaders in departments related to respiratory disease and chronic disease. We just talked about that. And so the layoffs prompted outrage from public health experts, but in a move that has sown further confusion at the agency, hundreds of those employees were later told their dismissals were rescinded. Say what? It comes as the CDC is still reeling from months of uncertainty after a change in leadership and priorities under the new Health and Human Services head, Robert F. Kennedy Jr. Dr. Angela Rasmussen, a virologist at the Vaccine and Infectious Disease Organization at the University of Saskatchewan in Canada, said Saturday that if the layoffs were made permanent, it would be a death blow for an agency that has already been gutted by previous cuts under Kennedy's leadership. CDC will have lost its ability to detect outbreaks and respond to them. It will no longer be able to track diseases in America and around the globe. That includes infectious diseases like flu, foodborne illnesses, and Ebola, as well as chronic diseases and injuries, she said. Rasmussen added that the loss of the MMWR would remove the CDC's ability to communicate with the public. Together, this means the CDC is not functional. It cannot carry out any of its mission, she says. America has no national public health agency anymore. Other physicians, including Michelle Au from Georgia State representative and anesthesiologist, noted on social media that the U.S. is barreling into respiratory season when viruses like flu, COVID, and RSV surge, and we're flying blind. On Saturday, hundreds of those who had received dismissal notices were then told they would be keeping their jobs, Reuters reported. Employees with the Morbidity and Mortality Weekly Report and the National Center for Immunization and Respiratory Disease were among those who had their dismissals reversed, according to Reuters. Andrew Nixon, communications director of the Department of Health and Human Services, told Time that employees across multiple divisions are receiving reduction in force notices as a direct consequence of the Democrat-led government shutdown. All HHS employees receiving reduction in force notices were designated non-essential by their respective divisions, Nixon said. HHS continues to close wasteful and duplicative entities, including those that are at odds with Trump's administration's Make America Healthy Again agenda. It comes at a time when the country's top public health agency has dealt with a blow after blow, from a tragic shooting at the Atlanta headquarters to Kennedy's firing of former CDC Director Susan Monarez. The White House Office of Management and Budget, OMB, has told federal agencies to plan for a reduction in force in the event of the government shutdown caused by a disagreement about health care and subsidies related to the Affordable Care Act. The gap between the two parties is primarily due to a Democratic demand to extend Affordable Care Act subsidies for low and middle income Americans, which are set to expire at the end of the year. The White House and Republicans have sought to blame Democratic leaders for the shutdown, and President Donald Trump told reporters in the Oval Office on Friday that firings would target those who are Democrat-oriented. These are largely people that the Democrats want, and many of them will be fired, Trump said. It will be a lot. The mass firings come just 2 months after the CDC experienced a mass exodus of top officials from the agency who said they were prompted to resign in August after Kennedy sidelined officials and ignored scientific research and protocols since he was assigned to his role to lead the department. Having worked in the local and national public health for years, I have never experienced such radical non-transparency, nor have I seen such unskilled manipulation of data to achieve a political end rather than the good of the American people, the CDC former vaccine chief, Dr. Dimitri Daskakakis, said in his resignation statement. I hope I pronounced that right. In a hearing with Senate lawmakers after her ousting by Kennedy, former director Monarez described heated meetings with the HHS head, who she says called the CDC the most corrupt federal agency in the government, and asked her to fire vaccine scientists without cause. I was fired for holding the line on scientific integrity. So a lot of this we know. So it looks like there's some back and forth going on whether or not these people will be fired, but it sounds like having access to the CDC and a lot of the journals and stuff like that, there's a concern, because as I go back to Reddit, I was reading some of the comments. Someone says, Jesus, this is grim. I'm considering downloading the CDC and NIH publications before they all get deleted, because there's some concern that maybe some of the publications, some of the articles, some of the information might get deleted. Do you know how many articles and publications there are? Like, you can't download them. Well, like, what? You would need like a whole operating system in your own house to be able to download all that information and to store it, right? So if you have the means of storage and access, don't consider it, do it. If a government agency can be cleared of all its employees overnight, it can be wiped out overnight. Someone says there's a CDC archive being hosted in Europe. Let's check that out. So here's the link. It says Restore CDC. I don't know. So it looks like it. There's a link here that was given, and I don't know what they're doing. They must be pulling articles and things from NIH. Let's click on A and see what comes up. What is the health? What are the health? Abdominal aortic aneurysm, abortion surveillance. Let's see, abusive head trauma. Yeah, they must be pulling all the information into here. Public health surveillance. This is another resource. I guess they're pulling it there in case it gets shut down. I'm like, anything can happen at this point. Anything can happen. I will put this link in the description box for any of you out there who want access to it in case the CDC and the NIH websites go down, because it looks like they let people go and then they told them they rescinded that. So who knows what will happen in the coming future. It seems like everyone is somewhat disoriented, and drop me a comment. Let me know what you think about this. How are you guys out there feeling about this? It sounds like pretty much the CDC will be shut down. Will Robert F. What's his name? RFK? Will he have a job if they keep laying off people? They won't need him as a director. I don't know. Drop me a comment. Let me know what you think every day. So there's something new, and these are all things that are related to our health. These are studies that are available, information related to things. I mean, I know I use the CDC website. I use the NIH to do a lot of research about things. I know a lot of doctors use it. A lot of medical professionals use it. What are you guys doing out there? Anyway, this is for all my medical professionals out there. It's called restorecdc.org. I will link it in the description. What is the world coming to? All right. Drop me a comment. Let me know what you think about this. Drop any links or information that you have that may help our fellow healthcare workers out there. And I will see you in the next one. Sending you love. Bye.